Hi, everybody. Welcome to today's webinar. We're just a little bit early because I want to go ahead and hit broadcast so everybody can start joining into the webinar so we can get started right on time. So we'll just give everybody a minute or two to get logged on. Oh, and then there's that. It's my 2 o'clock alarm to get up and stretch because I sit too much. All right, it's right at 2 o'clock Central. I say we go ahead and get started. It looks like quite a few people are on, and so we'll just jump into it. My name is Amy Knight. I've got Erin Vallier with us from AlayaCare. I am with Knight CPA Group. We're a CPA firm that works exclusively with home health, hospice, and nursing homes and assisted living, and we're a full service accounting firm. So we've been involved in all of this PPP loan, EIDL loan, and all of this HHS Provider Relief Fund money that has been coming at all you healthcare providers. So today we're going to talk about what you need to know, specifically Medicaid providers. If you are a non-Medicaid provider and you're here, everything here is still relevant to you, other than I got one slide talking about what the Medicaid provider has to do to apply for this money. And we might, default to Medicaid terms such as, PAS and patient hours and not really days of service or visits. That's the only difference. The other data, how you spend the money, what's eligible, what's not eligible, it's all completely relevant to everybody across the board that has received this money. So don't feel like if you're not a Medicaid provider, you're not, what we're doing here, it still applies. So these are AlayaCare's pretty slides because they have a really cool marketing department. We've got Nick on the background with us in case we have technical difficulties. And these are my slides. So you can tell I don't have a marketing department, but that's all right. I got the data in here. So this is everything we know as of today, July 8th. I will say that at the end of this hour, there is HHS is doing a repeat of a webinar they did a week and a half ago or so. I am registered for that, so I'm going to jump off as close to on time as we can and sit in on that. It's directly from HHS to see if there's been anything new or any updates that would change the information I'm giving to you. If there are any updates, I will film a quick video because it's easier than typing an email. I'll do a quick video and I will include it in the email that's going to go out that will have a link to this recording as well as the slides, the handouts. So you'll get all of that in an email tomorrow. And so if there's any significant changes or more information to pass along, I will put that in the beginning of the email. I will bold it, highlight it. I'll get your attention, so you know which link it is, but I'll get that all out to you tomorrow. So I've got this little short disclaimer. Basically, I'm not a lawyer, so you might need legal advice on some of these interpretations. Quick agenda, and then I'm just going to jump right into it. So what is this Provider Relief Fund? And some of us are calling it stimulus payments. And the reason in my world at the firm, the reason we started calling it HHS stimulus is what we were calling it, because that's what it looks like when it hits your bank. That's the thing that shows up on your bank statement. So what happened here was this was part of the CARES Act, but honestly, out of that 880-page act, the first less than 100 pages was all PPP loan information. And we all studied that and kind of stopped there. And in the middle of dealing with that on April 10th, all of a sudden Medicare providers started getting all these payments. And we had to scurry and find out what this was all about. And so that's where we found the detail of Medicare was issuing these stimulus payments to healthcare providers to assist you with the additional cost to prevent prepare for and, oh, there's a third term, treat this whole pandemic, okay? So that's what this is for. This is to reimburse you for additional cost or lost revenue. Those are the two keys. The CMS administrator actually came out saying that there were no strings attached, and that's completely not true, irrelevant, not irrelevant, but it's not true. We'll say that for sure. There are some terms and conditions that apply that you'll want to read closely, and there appears that there are going to be some reporting requirements, although those have been put on hold as of right now. So carrying on, I want to go through this timeline, and this is straight from, try to, soften it up, straight from the HHS Provider Relief Fund website. If you simply Google Provider Relief Fund, HHS, you can get to their website, and they've got a ton of information there. But the reason I want to spend just a couple of minutes going through the timeline is because it's been very, very confusing on what is what. It just seems like there are all these payments flowing around, which is kind of the truth, but they've put a timeline to it. So very beginning, it started with what they're calling the general distribution, and went to all Medicare providers that billed Medicare in 2019. It was based on their Medicare revenue. Then 2 weeks later, they did another second round distribution where they redid the formula. And the way they redid that formula, they were trying to pick up those that had Medicare, but Medicare was a small portion, and and the provider did a lot more Medicaid. So some people got additional funding. Now, anybody that did a lot of Medicare, like a large percentage, if they redid the calculation, they probably owed money back. HHS came in and said, no, we're not going to recoup any funds, keep it, we're moving on down the road, okay? So now they've tried to catch everybody that's a Medicare provider, no matter what percentage of your revenue is Medicare. They've tried to capture everybody. Then they went on and they did a rural distribution that went to rural healthcare providers. They did these high impact distributions. That was the first round. They later did a second round. They did an allocation to SNF units, which is a skilled nursing facility. They did an allocation to these tribal units. Then on 6-3 was the final. If you were eligible for the general distribution but didn't get the most money that you could based on the formula given, you could apply for more, and this was the deadline for that, was June 3rd. Then they did the second round of the high impact distribution. Then last but not least, they said, okay, we're getting to Medicaid. Now we're going to do this Medicaid, and the way it reads, it's Medicaid, CHIP, and safety net hospital distribution. So they're doing approximately $15 billion to Medicaid only providers and $10 billion to safety net hospitals. So this does have to be applied for by July 20th. It's the deadline for applying for it. And we'll get into that a little bit more. So finally, 2 months later, they've gotten to the Medicaid portion of their distribution. To qualify, I need to move those people over there. To qualify for the Medicaid distribution, you have to meet all of these bullet points here. Every one of them is required. So you have to apply by July 20th, and you apply through the HHS Provider Relief Fund portal. There is an application. You can download the PDF application. You can download the instructions. It's not extensive, but it's not as simple as what came before. You must not have received a payment from the general distribution. I should put an asterisk on this. If you qualified for a payment, they tried to send you one and you rejected it, that disqualifies you from this payment. So even if you qualified and did not take the payment, then you do not qualify for this Medicaid distribution. This is only for people that have not qualified in the general distribution. You must have directly billed Medicaid, CHIP, or managed care program from any time in 18 or 19, or you own a subsidiary that bills Medicare during that period. You had to have filed a tax return for 17, 18, or 19, or be exempt from filing. You must have provided patient care after 1/31/2020. So that brings a question, okay, what if I'm a new provider? I got licensed in February, I've provided care, but I didn't bill last year. You're not eligible, and I'm sorry. Um, must not have permanently ceased providing care. So you couldn't have provided care last year and then no longer providing care now, then you don't qualify. And if you're an individual, you have to have gross receipts or sales from providing patient care, because you wouldn't have filed a separate tax return over there. You would have had to file your personal tax return, but you would have to have the Schedule C line 1 wages, which would be your patient care revenue. So your terms and conditions, this is where it says the terms and conditions state that it must be used for COVID-related expenses or lost revenue, which we're going to dissect, to, quote, to prevent, prepare for, or respond to, that was a word I couldn't remember, respond to coronavirus, and shall reimburse the recipient only for healthcare-related expenses or lost revenues that are attributable to coronavirus. It does require reporting if you received more than $150,000 from any of these distributions. It does not, this $150,000 threshold does not include a PPP loan or an EIDL loan. The allowable uses just are not very well defined whatsoever. And so that's where there's a lot of gray, and we're having to really do some interpretation. And my approach is going to be keep it conservative. Okay, so you're looking for expenses directly related to or incurred because of coronavirus. Replace of lost income. Again, we're going to get into these a little bit further. And then how do you prove these up and document them? So this reporting requirement originally said that it was going to be due, it said it was due for second quarter was due July 10th. Obviously that is in 2 days, and we don't know what we're doing for reporting. They've since come in and said that's not going to happen, and we will let you know. We will notify you of what we need in the reports and the due dates in the coming weeks. So I think you'll still have to report on every bit of it that you've got. It's just going to be delayed, okay? So just be prepared for reporting. You're going to have to document these additional expenses, and you're going to have to assume that they are going to audit every single transaction. That's how prepared you need to be for this. So think about that, and what you've got to do is you've got to justify this as an additional expense, not just a regular expense, okay, if you're going to claim it as an additional expense. So we're recommending that you have a separate bank account for this, and the reason why is because you've got this separate bank account that lives over here with just your HHS funds in it, and when you incur expenses and you pay them out of your operating account, then you've got the invoice for it. You can document it was for COVID expenses, and then you reimburse yourself for those expenses. And when you then transfer that money from your HHS account over to your operating account, then you've got the documentation to go with it. It also gives auditors a clean bank account that's all that it was used for, and that's going to be really nice record keeping for you. You also want to record all of the expenses in a separate general ledger account. So whether you use some kind of departments in your accounting software, many of you are on QuickBooks, you could use a class, like use the classes, or you could just have a separate segment of expenses that are directly related to COVID. I do not recommend having just one lump sum that says COVID expenses. I would have a parent account that says COVID expenses, and that would segregate it out. Legal fees, accounting fees, medical supplies, software, IT, technology, those kinds of things. Additional wages, labor, overtime, on-call, those kinds of things. Keep all of your invoices, your receipts for everything that you spend the money on. So they came out, So the way we get information is through FAQs, frequently asked questions, and we keep updated with these when they come out. And fortunately, they've been documenting the date that each question is released, so the Q&A, and so we go through and reread them. Well, they tried on 6/19 to kind of give us a little bit of clarification, but it didn't really clarify a whole lot. And here's what they said. For eligible expenses, okay, so remember there's eligible expenses and lost revenue, okay? We're going to get to lost revenue. Eligible expenses, it could be supplies used to prevent, not prevent, but to care for COVID patients or possible COVID patients. So you're looking at medical supplies, medical equipment, your workforce training. You know, there's new training that you've got to do to help them screen all of those patients. Developing and staffing emergency operations centers. I don't know if any of you guys have those. Reporting of COVID, not only reporting, but also the testing, the COVID testing that you might have to do. Any temporary structures that you had to build, or maybe put walls up to kind of segregate maybe your office personnel or your nursing stations where they come in and work. And then additional resources to preserve or expand care delivery, which to me was very interesting. And then it doesn't say that these expenses could not have incurred prior to 1/1/20. It says it would be extremely unlikely. So I'm going with it needs to be from January 1 forward. But that means if you just now get this money because you applied for it, you get to go back and capture those expenses that you've already paid. I know you've bought hand sanitizer and more PPE than what you normally would have bought. Those are COVID expenses. You've probably paid some wages for additional staffing. So here's some examples. Your PPE, your hand sanitizers, cleaning supplies. If you had to pay a cleaning service to come in and do a sanitation of your office, absolutely qualifies. Overtime wages, for people that are out on quarantine, or maybe you've got salaried people out on quarantine and you had to pay PRN to come in and cover those shifts. Those kinds of costs qualify. Accounting, legal, HR issues, hardware cost, you know, maybe you tried to set your people up to work from home for your office staff. That all works. And any kind of telehealth or work from home software. So lost revenue. I will say in the beginning of this, I was like, okay, we've got eligible expenses and lost revenue. Well, lost revenue is going to be kind of hard to document and deal with, but extra expenses is going to be easy. And now I've kind of flip-flopped on my opinion of that because they did not do a very good job of clarifying what expenses are allowable and like how far can you push it. So it's clear that the very obvious ones are allowed, and that's where I would err on the side of caution. And I'm sorry, I just saw Q&A pop up. I forgot to mention this. Please post all questions in the Q&A panel. It's much easier to answer questions there than it is from the chat box, okay? And we will stay on to try to answer as many questions as possible. And we've tried to leave ample time for questions, even with both myself and Erin presenting. So thanks for putting them there. And once we get through, then we'll go through and answer some Q&A. But now I'm looking at, so then what you need to know about lost revenue is if you can quantify your lost revenue, which is what Erin is going to talk about, and I'm just going to glaze over it. But if you can quantify that lost revenue, you can say, hey, I was down $40,000 this month from patients not allowing us into the home, and you can quantify that. You can document it. You can withdraw from that bank account $40,000, put it in your operating account. So now you can spend that money on even a broader range of expenses, which is the next slide. So real quick, how do you quantify it? And again, Erin's going to go into this. She's going to show you some tricks and different, she has AlayaCare software, but we're really talking about any software that you have. It may have these capabilities, and it's just a way to think about it. And you may have to do it manually, but I think you can do it. So we're looking at lost revenue could be due to fewer patient visits, especially you Medicare providers, canceled elective procedures, loss of referrals, non-admits, and there's another term called not taken under care, and then increased uncompensated care, so increased freebie care, if you will. So again, Erin will go into those, but once you've quantified your lost revenue, what can you use that money on? Well, you can use that money to cover any cost that the lost revenue would have otherwise covered, as long as that cost is to prepare for, or respond to coronavirus. So this now moves it into even like rent and utilities and things like that, because you need to pay those bills to be able to care for the patients, right? So they do not have to be specific to providing patient care, but they still got to be necessary to running the business. So I'm kind of thinking about the eligible expenses as being like directly related to COVID. Like these are because of COVID. They don't necessarily have to be direct care costs like wages or supplies, but they're directly related to COVID or coronavirus and software cost, right? But then this lost revenue can be used for any other necessary business expense. Now, I don't think that includes additional advertising and marketing. That's not necessary for patient care. Rent is, utilities are. So what are some examples there? So this could be to cover your regular contract labor, your health insurance, your rent or mortgage, your equipment leases, car leases. I get to ask this one all the time. Your licensing fees, software fees for your EMR software. It can cover all of those. So further details, and I'm getting kind of behind on my timeline here. So they don't have an expiration date, these funds. They're meant to last. It doesn't mean you can't just spend them all at once, but the point is you don't have to rush to spend them. They are there to be spent over the long term. We don't know if you're going to get more. There's no talk of it right now, so we don't know, and we don't know what's going to happen in the next 4 or 5 months, right? At the conclusion of the pandemic, if you have any leftover money, you are going to be required to return it. There's no talk about when that's going to be. There's been no talk about how to return money that you don't spend. If you have money and you say, you know what, I only needed a little bit, I needed 50,000, they gave me 150, just hang on to the other 100 and they're going to put out information on how to return funds. So you can do that. Anything not used appropriately can be recouped. We don't like that word, that's why I highlighted it. And you cannot use this money for the same purpose as your PPP loan money. So be careful there. And they do reserve the right to audit you. So watch out for that. Again, highly recommended that you have a separate bank account for these funds and a separate section on your profit and loss or your income statement in your expense categories to track them separately. When you get, here's how you account for it in your accounting. When you get the funds, it needs to be recorded as a liability into an account called unearned revenue. As you justify spending that money, as you justify either eligible expenses or lost revenue, and you're ready to take a transfer from that bank account, put it in your regular bank account, that's one transaction, that transfer, but then you need to book a journal entry to move that amount from unearned revenue to earned revenue in your P&L. That is going to be taxable income, okay? So just be prepared for that. How do you document this? Your guess is as good as ours right now, but we are talking canceled checks, invoices, receipts. Your general ledger is not going to be good enough. Your bank statement, not good enough. Your credit card statement, not good enough. Bank statement, credit card statement might be good enough for those transactions that are like auto drafted, like your lease, but they want the lease agreement to go with it, right? Like a car lease, that's fine, but they need the lease agreement to go with it. You need as much documentation as possible to justify these funds. Again, really read the terms and conditions. Don't just automatically sign them. And I'm going to launch our first polling question, and I'm going to try to make it quick. Let's see, launch. Oh, wait a minute, in polling. Hold on, that was the wrong one. Okay, here's mine. Launch. How are you keeping your Provider Relief Fund expenditures segregated for reporting purposes? My answers are really wordy, I'm sorry. The first one is you've opened a new bank account, you withdraw as qualified expenses are incurred, and you have separate GL accounts. The second one would be you did not open a separate bank account, but you've got separate GL accounts that you're tracking it. The third one is you're keeping it all in a spreadsheet, and then we're not really doing anything at all. Or lastly, I always like to put something in, about a little plug for myself. Did you outsource all of your accounting, and you know that your rockstar accounting firm like us are taking care of this for you? We have a lot of people that we're taking care of this for them. So we'll let that go for just a few more seconds. And it's a fairly even split between two of them. Okay, I'm going to close it and share the results. So it looks like it's almost evenly split between the full detail of separate bank accounts, separate GL accounts, really tracking it over the top, versus you're keeping it all on a spreadsheet. So not saying that one's better than the other, just I say do as much as you can. This is one of those prepare for the worst, hope for the best kind of situations. So I'm going to go back to my slides and just let you guys know, what should you be doing now? I say on this, and I'm not a conservative person by nature, even as a CPA, but I'm being super conservative on this. I'm afraid the government might have a little buyer's remorse later. And so just make sure you're really documenting everything. Keep all of your records. And this is the other thing. Stay tuned to the resources around you that are trying to send you info. The cheapest, fastest, easiest way for someone like myself that's studying all this to get the message out to the masses is by email. So just look at those emails and make sure there's not something of value in there instead of just deleting them, because I know how it is. I get lots of emails myself. But we're getting out information as quick as we can, and we're here to help. I will send out these slides afterwards, and then I'm going to turn it over to Erin. Let me stop my share. Erin, it's your time.
Awesome. Thank you so much, Amy. Let me see if I can share my screen. All right. Can everyone see an orange slide?
Yep, you look good.
Yep. Awesome. So to expand on what Amy has taught us so far, allowable use of these funds, according to HHS, includes, of course, expenses to prevent, prepare for, or respond to coronavirus, including testing for COVID, and then the healthcare-related expenses and lost revenue. These broad categories leave a lot to interpretation, but one thing that comes to mind here is technology, and specifically technology to help prepare for and prevent the spread of COVID. Virtual visits, screener, contact tracing, we'll go over some of these today. And for healthcare-related expenses and lost revenue, I believe you're going to want to consider tracking metrics such as missed visits, refused visits, hiring and training new employees, year-over-year revenue to report your losses, and certainly PPE. That's everything. We're in alignment with what Amy has said today. But what I want to focus on for the remainder of our time together is how to leverage technology to track and report on relevant COVID-19 expenses and data to verify appropriation of relief funds. And I'm hopefully going to give you some ideas on how you can invest some of those dollars into your business to set you up for success moving forward. When it comes to reporting, home care and home health providers should be placing a high value on technology that empowers you to harness your data in creative ways, and it doesn't limit you to a short list of canned reports. At AlayaCare, we integrated with the business intelligence tool so that we could provide a high degree of reporting power and flexibility to our clients. And recently, we've been learning from our clients what reports they're leveraging and what the various states and jurisdictions are expecting of them as we are returning back to the quote-unquote new normal. And I'm happy to say we've been able to quickly respond. Some of the reports that are being leveraged right now include COVID screening results, and contact tracing. And one that is used a lot, I think, is to help manage caseload and staffing, and we call it the time off due to COVID. And I'll touch on all three of these briefly. And since none of these tools would be required had there not been a pandemic, I believe you can and you should be taking these costs into account when applying for and attesting to the proper use of HHS funds. And a few additional reports that I feel are worth mentioning here is a COVID risk report that's age and diagnosis related. Of course, lost revenue due to COVID and expenses due to COVID. One very important variable here in that expenses related to COVID is PPE. I won't have time to show that report specifically today, but report on your PPE. That gives you the ability to look back over previous months to evaluate usage and project future use in order to make the strategic decisions about stockpiling. And of course, if you have any questions about these reports after the webinar, just reach out to us. We'll happily help you regardless of if you use our software or not. And before I transition into the individual points and reports, I'd like to point out that in general, even prior to COVID, we saw that the most successful agencies in the marketplace shared some fundamental traits and habits. For one, they were and they still are investing into the right technology to run their businesses. And now how this specifically applies to COVID is the most successful providers are placing high value on certain factors when evaluating software partners, such as partnering with an end-to-end cloud-based solution to support remote work and promote social distancing. And that means that it's essential for the solution you select to provide you with access to information. For example, on a mobile device, prior to or during a client interaction, can your caregiver see important information about that client and about their own schedules? And does this solution provide your care coordinators the ability to schedule and see availability of caregivers from wherever internet is available? Just things to keep in mind. Also, complex scheduling is another consideration. To promote safety in the workplace, staggered scheduling is now being applied, and practices such as assigning caregivers to COVID pods and teams are also being employed. And you'll want a technology partner that can help you identify COVID patients and give you the flexibility to manage them separately. Also, contact tracing for infectious disease control is essential if someone within your sphere of influence tests positive for COVID. Agencies are placing a high value on solutions that provide the ability to verify data collected in the field in real time. Screeners, remote patient monitoring data. And for referral sources, having a solution that allows you to prove that you can provide safe and secure services will absolutely influence referral volume. And internally, keeping a close watch on business performance is critical right now, more than ever. You'll want to consider creating your own dashboard of reports that track COVID-related KPIs. In essence, invest in your back office. This will help you preserve margin. Obsess about design. Place a high value on user experience and minimizing minimizing clicks and keystrokes. You'll also want to obsess about your own data. Specifically, can you access it? Can you leverage it however you see fit rather than being locked into what the system provides? And a final thought, choose a platform that will enable multiple modes of care. Home care, home health, virtual care, call centers, Meals on Wheels. It's time that we start diversifying and rethinking our delivery models, and you're going to need a flexible solution to support you in that venture. Okay, so let's talk about some of the reports you're going to need when applying for Medicaid funding and attesting to the proper use of it. So lost revenue is something that the guidance specifically mentions, as Amy also mentioned. And according to HHS, lost revenue estimates should be based on budget to actual or year over year. It should take and should include revenue from all sources that can be attributed to COVID-19. And that could be value-based payments even. In AlayaCare, you can easily create this report using our business intelligence tool. And the report you see here is just a general example of lost revenue year over year due to COVID-related cancellation But you can add additional variables to this report and tweak it to fit your needs. In AlayaCare, you can create your own list of reason codes and assign them to various events. And once you've created things like a COVID time off type, a COVID visit cancellation code, a COVID on hold code, and any other COVID tag, you can assign that to various events and then report on it so that you can attribute lost revenue directly to the pandemic versus the normal fluctuations in business. And that's going to help you out a lot. And going a layer deeper into lost revenue, we recommend definitely looking at this, spinning it in multiple ways so that you can get a holistic picture. Our projected revenue versus lost revenue report is not only essential to support the information entered on your application for relief funding, but it's also super important for the purposes of managing your cash flow closely. Due to the COVID crisis, I believe it's best practice to manage your cash flow by setting very short goals, maybe a monthly plan, but monitoring it on a weekly or even daily basis, depending on the scenario. Now, hopefully the relief funds can make a positive difference here. And I think I've read, Amy, you can correct me if I'm wrong, but I think the relief funds will start hitting bank accounts in August. At AlayaCare, our Alaya Labs department focuses on really interesting projects involving artificial intelligence and data analytics. And presently, they're creating dashboards for executives that help them track the impact of COVID-19 on their business. And the report you see here is just one of the reports available on that dashboard. This is actual data from one of our tenants, and it's sort of a worst case scenario here. Some of our clients are actually enjoying increased revenue due to COVID, so it's not all gloom and doom. But what you're seeing here, the green line is projected revenue, and that's taking into consideration scheduled visits over a period of time and the billable rate associated with those visits. So that's what you should be making. And the orange line is the actual lost revenue. So that's considering the actual canceled visits tagged with the COVID reason and the billable rates. And you see this report, the lines are getting closer together. So that's just not an ideal scenario. The data lines at the bottom, those look back over 14 days and calculate the upper and lower threshold for canceled visits. So definitely a useful report. Another element that will help you track lost revenue is tracking the canceled visits and being able to differentiate the normal canceled visit from one due to COVID. And you'll likely need this info in some format to meet relief fund programming requirements. In AlayaCare, we provide users the ability, again, to select reasons for different events like visit cancellations. And each tenant has the ability to build their own library of codes, so that it's very customized to your needs. This allows the reasoning to get very granular when it comes to reporting. If you're not a current AlayaCare user, you may want to contact your vendor and see if they're able to help you tag your missed visits in some way and then report on them later. But in our software, when you cancel a visit, you can select from a drop-down a COVID-related reason, and then you can report on it using our BI tool. The report you're seeing here is an example of that. You've got 3 weeks worth of data. The blue is due to COVID, and you can see over time the blue is growing, and the other reasons are shrinking. And this same concept about being able to attribute an event to COVID holds true on a number of variables that we're going to go over, like employee time off. A fourth report that I believe is essential right now is tracking all the other expenses related to COVID. As Amy mentioned, one of the stipulations of the relief programming is the money must be used to pay for expenses that are related directly to COVID. This can include many items like the tests, PPE, mileage, visit premiums to see COVID positive patients. Any additional expenditure that you might want to layer on top of a service date that can be directly related to COVID can be accomplished using a good BI tool. Now, how you would accomplish this in AlayaCare is first setting up those visit premiums in your settings for your staff to assign to visits. Prior to visit approval, they'll need to add the right COVID-related premium or COVID-related tag to that visit so that you can capture it and report on it later. And what this report is showing, and this is just a testing environment, is a number of different categories of spending, COVID-related expenses, PPE, this could be test kits. And the green line that's across the screen is showing you the average amount of expenditure in those different categories so that you can easily visualize the overage here. All right. Now I want to shift to operational costs for a moment and talk about screeners and the costs associated with managing the return to work after an infection or just returning to the office in general. And don't forget that a change in process is very costly to your business, and it takes time and resources to train employees and to facilitate and monitor these new processes. So let's capture all those costs. Tools like COVID screeners are really instrumental to preventing the spread of the disease. So I'm going to touch on those briefly. Whatever method you choose, it's just got to be simple and effective. And it should prevent an aide from making visits if they say yes to one of those questions. Our COVID screening tool is fully integrated into the system so that before every single shift, a caregiver is prompted to screen themselves and screen the client. The screener is completed on a mobile device and it updates records in near real time. The results of these screeners are pulled into a report that's deployed to all of our environments so that it can be managed by a staff member. If any of the screening questions are marked yes, your team has the opportunity to enact the emergency processes you put in place and get that person tested or quarantine them, and certainly reschedule their shifts. And this not only helps you track direct expenses, but it will also help you track soft costs. You can extrapolate from it who's going to be taking advantage of the enhanced unemployment benefits and whose shifts you're going to need to fill in the immediate future. And a bit more about screening. With technology, it becomes really simple to manage caregivers coming back to work after showing symptoms of COVID. At AlayaCare, if you want your caregivers to complete a COVID-19 post-illness assessment before returning to work after showing symptoms of the coronavirus, you can create that form with our form builder tool and assign it to them as a task once your organization has deemed them eligible to return to work. And you can report on which tasks have been completed or not to keep you compliant with your COVID response processes. And this is something that was absolutely required in certain states. And as I continue with the theme of operational costs, let's talk more about the return to work, because many of you have probably had an employee who tested positive for COVID, want to pick up shifts again once they've been cleared to do so. And if you've been fortunate enough to avoid this scenario so far, it might be relevant to you at some point in the near future. So I hope I don't lose you here. In AlayaCare, once the caregiver has responded yes to any of the questions on your initial COVID-19 screener, or they've called the office to report symptoms of the coronavirus, your back office staff should schedule a period of unavailability for that caregiver for the time frame determined by your agency and your local health authority. With our technology, you can create the COVID time off type, or whatever else you want to call it. And after you've created that type, you can build a report with our data exploration tool to keep track of the employees who have this time off type. Now, as with all of our reports, if you need to keep this front and center when you log on to AlayaCare, you can pin it to your dashboard, which is customizable to each end user should you give them the permissions to do so. And running this report will bring visibility to which caregivers with the COVID time off type are nearing the end of the number of days they're required to take off before coming back to work. And that's going to help you manage the workforce and your caseload much easier. And for non-AlayaCare users, you might also be able to accomplish the same results with your EMR partner. We highly encourage you, reach out to them and see what's possible in that regard. I know that many of the solutions out there are quickly responding to COVID as we did. Now, this brings me to contact tracing. This is another thing you would never have to do without a COVID pandemic. But once your employee or your client has tested positive for the coronavirus, you're going to need a way to quickly and easily trace their steps so that you can notify individuals they've been in contact with of the exposure. This task can be incredibly complex and difficult to accomplish manually. Now, at AlayaCare, We developed a contact tracing feature to help organizations identify which clients, employees, or facilities may have come into contact with a client or employee that tested positive for COVID-19. As part of the beta phase of this project, organizations can request to receive a contact tracing report that identifies the web of contact within your agency for those specific clients, employees, or facilities with up to 3 degrees of separation. If you'd like to learn more about this, you can reach out after the webinar. I'll happily answer any of your questions. Continuing in the spirit of using these relief funds to help you prepare for COVID-19 or respond to the coronavirus, you may also want to consider a process to identify and track clients that are higher risk based on age and diagnosis. You'll need the ability to manage this population separately if you're not already doing so. For example, you might choose to schedule these clients earlier in the day and ones with COVID later in the day. Or if your census supports, you might assign a group of caregivers to only see COVID patients to further reduce the possibility of cross-contamination. Now, in AlayaCare, it's easy to identify this client population by creating a COVID risk report with our BI tool. The report can take into consideration age, diagnosis, and assign a risk level based on certain parameters that you set up. And again, thinking about COVID-related expenses, the personnel assigned to managing your internal processes related to COVID, those do count, especially if you had to shuffle some things around or hire someone new so that you could have 1 full-time or 2 full-time people dedicated to facilitating your emergency plans. And there might be a number of reasons why your caregivers and clinicians can't make it to their visits right now. Inadequate PPE, patient concerns about the risk of COVID, or the roads are closed and they can't get across town. So with all these forces in action, it's really important to have tools and processes in place to provide the best care possible, despite the inability to be face-to-face with a client. At AlayaCare, we wholeheartedly believe that virtual visit capability is no longer a nice to have, it's a must have in this COVID world. And there are a number of solutions you can choose from. But one thing to consider is the value of a technology solution that fully integrates the virtual visit component into the client's record. This is important when it comes to streamlining documentation, billing, payroll, reporting, and not to mention the fact that a virtual visit documented in this matter becomes part of that official visit record should you need to produce it for a payer source or a regulatory body. And some feedback that we've received from clinicians who are using this technology is that they really appreciate being able to conduct a virtual visit and simultaneously chart all from one platform. Now, there's 3 tools I'll briefly mention here that we're seeing leveraged more heavily right now across a number of verticals. Actually, I read something this morning. From April 2019 to April 2020, virtual and telehealth visits have increased in claims by 8,300 and some odd %. So that's significant. We know for a fact that virtual visits are here to stay, and the driving force of that is COVID. So leverage this money to invest in your business so that you can keep running. But virtual visits, family portal, and remote patient monitoring are the 3 solutions that I want to mention. For virtual visits, in the event someone doesn't pass that COVID screener when you're standing at the door, you're going to need to launch a virtual visit on the fly to provide care. And I've heard tell that as part of an emergency response, some agencies are conducting virtual visits with a field supervisor when this scenario occurs. I also hear that some agencies are using virtual visits for their initial assessments for home care so that they can fully protect the administrative staff who is onboarding new patients or clients. As for the family portal, families might need to sign those documents you're sending to them so that for consent to treatment. They might need to see schedules, request additional services, put themselves on hold because they've got COVID, see invoices, streamline processes, all of this stuff to maintain social distancing. So let's keep that in mind. And also remote patient monitoring. There's a lot of evidence that this technology reduces the cost of healthcare delivery and keeps patients out of the hospital. This is especially important for that subset of patients with chronic diseases that put them at much higher risk for COVID. You don't want them going into an acute care setting right now. And as a side note, I believe that now is the time to invest in these tools and that early adopters need to record the benefits of virtual visits so that the data proves to payers that it's worthy of reimbursement, similar to Medicare Advantage improving the value of home care. Anyway, so given that telehealth might be a line item on your cost report right now, it's pertinent to track that expense and bundle that technology cost into your COVID-related expenses. And now we're going to go to a second poll question for the day. If you'd like to learn more about AlayaCare in general, or especially our virtual suite, any of our COVID tools, just take a moment and let us know, and we'll happily respond. And while you're responding to that poll question, we're absolutely here to help. I hope that the information I shared today was relevant to you. I've gone over several different reports that you can use to track your expenses, to track your lost revenue, and provided you some ideas that you can use to spend that money, invest in your business, keep your staff safe, and your business going. I'm going to turn it over for questions.
Hey, I forgot I was on mute. The poll is still running. You got several people that would like a video. The only thing is, and guys, we're kind of rookies. We're not professional webinar hosters. I'm not sure if I will get a report that shows me who asked for a video. So,
Amy, you will.
Okay, thank you, Nick. We love Nick in the background.
Good.
Okay, good. Okay, I'm going to go ahead and end it. Well, there's still some people voting. Okay, I'll end it now. If you didn't get to vote and you would like some, just email us and we will definitely get that over to you. I'll get it over to Erin. Okay, let's go into questions and answers. I'll stop this and close that. So the first question is a really good one, and I was actually just looking on HHS's website, see if there was anything new. First question said, how long should the application process take? I don't know. Erin, have you seen anything on that? On the application itself?
I was in that webinar, the first one that, there's a redo of it today. It didn't look like it would take very long to fill it out, just like one sitting, but you just have to make sure you've got all the information required.
But how long for them to process it?
Oh, to process it? I believe they said the funds would start hitting bank accounts by August the 25th, and it's going to be processed on a rolling basis. So my advice there is to definitely just get in there early, because it says they're processing them as they come in. So you definitely want to get in there early.
Yeah, and I'll look for that too. That's really a question. I should know the answer of that, and I don't. So I'm going to leave that one unanswered, and I'll put it in my follow-up email, what I can find on it as well. The next question is, what if we're a subcontractor to a Medicaid agency? Can we apply for the relief funds? I'm going to say no, because you did not bill Medicaid directly. So that one is not going to be eligible. I just accidentally dismissed the wrong one. Nathan, can you I will confirm that, it says, please confirm to me that a Medicare provider that relieve less than $150,000 in relief funds will not be required to account for the expenditure of these funds. That is what they're telling us. That's not just what they're telling us. That is what the terms and conditions say. So yes, you will not have to be do any reporting. Can a non-medical home care provider apply if we are Medicaid provider? Yes, it's exactly, you're absolutely eligible for this. And then, will you be sending the presentation slides? Yes, we'll send those out in an email tomorrow. Yes, we are. Our firm is helping with the HHS applications. We're actually working on one today. And I apologize, I thought that was in my slides. It was not. I know what they're asking for is payroll at May 31st, 2020. you're having to document what your payroll is. You do have to provide a tax return. You do have to tell them what is your estimated lost revenue. We're going to be working through how we're going to go provider by provider and just help you calculate that and figure out the best way to calculate it that can be justified. Provide a tax return. That's the meat of it. It's not a lot, but it's not as easy as they made it on the Medicare providers.
I have one that's in the chat. I can chime in.
Okay, go ahead.
Yeah, will staggered scheduling for office staff be considered an eligible expense? I have 4 office staff members that would normally work 40 hours per week, but now due to social distancing, they work 2 days a week, but they get paid for their full 40 hours a week. So processes that you put in place to react to respond to prepare for COVID, and comply with OSHA and CDC guidelines for returning to work will count. And Amy, this might actually also count for if they got PPP money, right? Because this would be salary that they're paying people, but they're not actually working. So do you want to add some color to that?
Yeah, so be careful with you can't do PPP and HHS money, but there's a little bit of planning there. And so what we've been doing, if there is any payroll that qualifies under this HHS, we recommend using HHS monies to pay for that, because now your PPP has been extended. You don't have 8 weeks that you got to spend it. So all you got to do is run another regular payroll or two to spend out the rest of your PPP money. So what we're saying is, so what I would do in that exact example is if Susie Q is working 2 days a week, she's working 16 hours of work time, and then she's getting paid for a full 40. So what's that, 24 hours not worked? I would, like you're talking about separate codes, I would set up separate pay items. I would say hours worked, COVID hours not worked, or something else. Label it COVID so that it's very clear in your reporting. And at the end of the pay period, you can say, let's say you have both PPP and HHS money. You can say, okay, here's all my regular wages, PPP. Here's my COVID wages. I'm pulling that from HHS. So that's what we're advising, because a lot of people are doing COVID bonuses, and in the beginning, we were saying, hey, that's all PPP eligible, because you were having to spend up all that money in a short amount of time. Now we've changed because they've extended the PPP loan. You've got 24 weeks to spend it, and nobody in this field is having any problem spending it. So now we're saying, pull your bonuses out of HHS money. Hazard pay bonuses, but we actually went back on some bonuses and called them COVID. I had the payroll company change the pay item. It was separate, but it didn't say COVID. I said, go change it, rerun the reports, and it worked like a charm. We just did it this week. This one asks, what is lost revenue? And basically saying, is it comparing 2019 revenue to what you got 2020? I feel like I heard somebody say, maybe I've listened to a lot of BKD webinars on this. I feel like somebody said that simply comparing what you got last year to what you got this year in revenue was not going to cut it.
It's not. You have to take all considerations due to COVID. That's your value-based pay. What was it last year versus what is it this year? Did you get docked for some reasons because you couldn't see the client? COVID cancellation versus the regular cancellation. So you have to do a year-over-year comparison or a budget to actual comparison, but you have to, in that comparison for this year, you're going to want to be able to use all those tags and say, this is how much revenue I lost because these are my canceled visits directly related to COVID. Like, you're going to need to get very granular so that you can tweeze out the normal fluctuations in business versus what is actually due to this pandemic.
Yeah. I mean, the one that I've seen a lot of talk about is if you, especially like a skilled provider, take in elective surgery, and so they've got Dr. Joe who does 10 surgeries a week, and they get 10 referrals a week, and they've got no referrals. they've been able to quantify that. But again, that's very granular and you can get very, very specific. So I don't think just comparing last year revenue to this year revenue won't cut it. So you'll want to get more detailed than that. Will documentation we required to submit is for 2019? The documentation we required I don't understand the question. It says the documentation we require to submit is for 2019 question mark. So I'm not sure if that's in relationship to the application or not. What funds are coming out August 25th? We're going to check that, but that's what Erin recalls when these funds will be rolled out, actually deposited. Can primary healthcare agency apply for it? PAS services, yes. So as long as you're not private duty, like private pay, if you're billing Medicaid or a Medicaid MCO, you can apply for this. And you can go through and apply, and if you don't qualify, they'll just say no. It'd be a little bit extra work. If we are short in the PPP loan for payroll, can we use relief funds to supplement? Yes, good question. Once your PPP loan is spent fully, you can then start using, well, you can, if you document, so let's say PPP loan is spent, if you can document, I've lost revenue because of COVID, so you're documenting lost revenue, you withdraw those funds from your HHS bucket, then you can use that to pay regular payroll. If it's additional payroll or COVID specific payroll, like additional pay, hazard pay, then you could use that as an eligible expense for HHS. It gets very confusing, I know. It's the best we can do. If we have documentation of revenues from last March through June 2020, can we include these 3 months on lost revenues? Is it only March and April? Brenda, I know what you're getting at there. The way the application, the way the act was reading and it was only March and April because, you know, we all thought this was just going to happen in March and April and then it'd be gone. And that's not the case. So it does not appear that you can include revenue from March through June. And I will say, your story is consistent with what we're seeing in Texas. By the way, Erin's out in Colorado. You can see her beautiful background there. Everybody really started taking their hits in May is what our clientele has seen. So I don't know if they're going to budge for that or how they're going to do that. So we'll look at that when we're going through the application process. Is there a difference in eligible qualified expenses for HHS stimulus money versus what you can use with the EIDL loan? Yes. So EIDL loan is a bit vague. EIDL loan is there to, it can cover any business expense regardless. The only thing you can't do with EIDL loan is take distributions as a dividends or distributions as an owner. And I think there are some owner compensation caps, but they're pretty high. So the EIDL loan, it's just a loan, you're gonna pay it back. So it can be used on on pretty much anything. Advertising, you know, getting creative with your marketing. EIDL loan can be used for any of that. I also don't think it can be used to pay off other debt, but don't quote me on that. That is different because EIDL loan's been around for a long time. It's what they use when there's a hurricane or a natural disaster and people, you know, the businesses get wiped out, their house gets wiped out, and they're given an EIDL loan to rebuild or reestablish their business. So those have been there for a long time. So that's a lot different than this HHS stimulus or the PPP loans. Is there anything else in chat?
I don't think so.
Can you please talk a little more about small companies like me getting much less than 100K? So if you're getting less than $100,000, you still have to abide by all the rules. You just don't have to prove it up unless they come knocking on your door. So you won't have to do the reporting quarterly, but you're still required, you're still bound by everything we've talked about. You're still bound by documenting all of your expenses. So documenting the eligible expenses that are COVID specific, documenting the lost revenue, which means I took out of this account to cover my lost revenue, and the expenses you paid with the lost revenue money. You have to document all of that. So just because you're receiving a smaller amount, the only difference is you just don't have to do the quarterly reporting. The documentation, okay, I think, is the PPP loan used towards the gross wages or towards net wages? So this is on PPP loan. By the way, I have another in-depth PPP webinar I did last Wednesday. It's recorded. It is on my YouTube channel under Night CPA Group. But it is gross wages, for sure, gross wages to answer that. But if you want to see that detail, that went about an hour and a half, I think. So, okay, any final closing words, Erin? And I'm going to go jump on that other webinar.
Yeah.
And we'll get you guys all updates tomorrow.
Yeah, I just wanted to say I did check my notes from that webinar that you're about to attend, and it confirms that, you know, they're going to process on the rolling basis, and they'll start distributing those funds at the end of July, or I'm sorry, end of August. And I think I heard them when they were talking around August 25th. So that'll give you an idea how long it's going to take you to process, because of what the end date for applications is the 20th. So
Yeah.
it'll take about a month to process. So get them in early. And,
Yeah.
and with regard to anything that I spoke about today, if you have any questions, I'm right here. So just reach out.
All right. Thanks, everybody. Again, we'll send an email tomorrow with the recording, the slide deck, and any other news that I come up with. So I appreciate you guys for attending. Thanks, Erin.
Thanks, Amy.
Nick. See you guys.
Thank you, Nick. Bye-bye.
Bye.